What is ACS, in Australian medical coding? ACS in Australian medical coding stands for Australian Classification of Health Interventions, ACHI, Clinical Coding System. It is a coding system used to classify the healthcare interventions and procedures provided to patients in Australia. The ACHI system is part of the broader Australian coding standards, which also includes the International Classification of Diseases, 10th revision, Australian modification, ICD 10AM, for diagnoses and the Australian Coding Standards, ACS, for administrative data. The ACHI system is used to assign codes to healthcare interventions and procedures such as surgeries, diagnostic tests, and therapies. These codes are then used for a variety of purposes, including reimbursement, research, and quality improvement. Overall, the use of standardized coding systems such as ACHI is essential for ensuring accurate and consistent documentation of healthcare interventions and procedures, which is crucial for effective healthcare management and planning. Basic guidelines of ACHI, ACS, ICD 10AM. The Australian Coding Standards, ACS, provide guidelines for the use of the Australian Classification of Health Interventions, ACHI, and the International Statistical Classification of Diseases and Related Health Problems, 10th revision, Australian modification, ICD 10AM, in medical coding in Australia. Here are some of the key guidelines for each coding system. 1. Australian Classification of Health Interventions, ACHI. The ACHI codes should be used to identify the healthcare interventions and procedures provided to patients in Australia. The ACHI codes should be assigned based on the documentation in the medical record, such as the operative report, progress notes, and discharge summary. ACHI codes should be assigned to the highest level of specificity possible based on the available documentation. ACHI codes should be assigned for each procedure performed during an episode of care. ACHI codes should not be assigned for procedures that were planned but not performed, or for procedures that were attempted but not completed. 2. International Statistical Classification of Diseases and Related Health Problems, 10th revision, Australian modification, ICD 10AM. The ICD 10AM codes should be used to identify the diagnoses and conditions of patients in Australia. The ICD 10AM codes should be assigned based on the documentation in the medical record, such as the diagnosis statement, progress notes, and discharge summary. ICD 10AM codes should be assigned to the highest level of specificity possible based on the available documentation. ICD 10AM codes should be assigned for each condition that is being treated during an episode of care. ICD 10AM codes should not be assigned for conditions that are not currently being treated. 3. Australian Coding Standards, ACS. The ACS provides guidelines for the use of both ACHI and ICD 10AM in medical coding. The ACS includes general coding principles and conventions that apply to both ACHI and ICD 10AM. The ACS provides guidance on the use of modifiers, which are used to provide additional information about the procedures or conditions being coded. The ACS also provides guidance on the use of external cause codes, which are used to identify the cause of an injury or illness. Overall, adherence to the guidelines provided by the ACS, ACHI, and ICD 10AM is critical for accurate and consistent medical coding in Australia. We can see the guidelines one by one in upcoming sessions. Thank you.